This training is brought to you by the Child Life Department at Yale New Haven Children's Hospital. The learning objectives you will achieve throughout this training include reviewing the purpose of a sensory toolkit and how it can be utilized in the hospital setting, understanding the proper use of each item within the toolkit, and recognizing special considerations to take into account when utilizing this toolkit with patients. Sensory toolkits are a designated bin. They contain a variety of sensory tools that can be used to either stimulate or calm a patient's sensory systems. This is based on their individual needs. Child life specialists often utilize sensory toolkits when working with patients with a diagnosis of autism or other neurodevelopmental diagnoses. The hospital environment, both inpatient and in the ambulatory setting, can often overwhelm a child's sensory systems. This is further exacerbated when the child has a diagnosis of autism or other neurodevelopmental diagnoses. This can lead to behavioral problems while in the hospital, as well as some safety concerns and difficulty coping. We will walk you through each of the items located in your unit's sensory toolkit and review their purpose and function.
The first tool in your sensory toolkit is a pop tube. Pop tubes strengthen muscles involved in two-handed activities and provide auditory, visual, and tactile feedback.
Noise-canceling headphones are designed for patients with noise and auditory sensitivity. These noise reduction earphones are comfortable and user-friendly for children. The headphones are designed to reduce surrounding noise for those with sensitivity to auditory stimuli. Your sensory toolkit contains one child size and one adult size. The child size are light blue and labeled child, and the adult are blue and black and they're labeled adult.
The third tool in your toolkit is a weighted lap pad. Weighted lap pads provide proprioceptive input and helps establish increased body awareness, improves attention span and concentration. The pad contains evenly distributed weight to provide calming sensory input. Also in your kit is a weighted blanket. Please understand that both the weighted lap pad and the weighted blanket are not for use with infants.
The next item in your kit is a light-up DNA ball. These are popular sensory integration fidget toys, as well as a cause and effect activity. This tool provides tactile and visual input for patients. The next item in your toolkit are plastic sunglasses. These are for patients with sensitivity to light or other visual stimuli.
The next tool in your toolkit is a mini rain stick. Mini rain sticks provide auditory and visual feedback, most soothing when turning over slowly rather than shaking vigorously.
The next item in your toolkit is a liquid motion gravity bubbler. This offers a calming visual stimulation and can also be used as an engaging visual timer.
The next item in your toolkit is pin art. Pin art provides visual and tactile feedback as well as calming sensation as the patient pushes on the small pins to create impressions. Great for encouraging hand function and imagination, as well as working on fine motor skills and finger isolation.
Your next item is the olive massage ball. Textured products provide sensory enhancement, relieve tension, and increase emotional stability. The massage ball is easy to hold, grip, and carry. The massage ball provides stimulating touch development, builds tactile defensibility through throwing and catching, and sensory enhancement from hand gripping and releasing.
The next item in your toolkit is flexi rings. Flexi rings provide sensory and tactile stimulation, can be used to promote focus and concentration, keeps hands occupied to reduce tension and provide calming.
The next item is called Texture Tangle. This tool provides fine motor manipulation along with the therapeutic benefits of control, dexterity, concentration, and focus in problem solving. Low-impact activities like tangle also relieve stress through the easy twisting and turning motions.
The next item in your toolkit is a multi-textured tactile ruler. The ruler is an effective tool for distraction and anxiety relief. The ridges and indents provide a variety of tactile feedback to reduce stress and promote calm.
The Atom Ball is a sensory fidget toy that helps relieve stress. It provides multiple means of tactile stimulation with bumpy texture as well as elasticity.
The next item in your toolkit is a glitter tube. The glitter tube provides both visual and tactile feedback for children. The tube encourages gross motor skills and is great for visual tracking.
The next item in your kit is a TheraPressure sensory brush. The brush is run over a child's skin using firm pressure. This tool is used with children who have sensory sensitivities, with the goal being to decrease fear or discomfort of being touched. This tool can also improve ability to transition between daily activities, improve attention span, enhance coordination, or provide better self-regulation.
The last item in your kit is chewy tubes. Oral chewing tools are designed to provide resilient, non-food surface for practicing biting and chewing skills. The shape allows children to easily manipulate and hold tube while preventing them from pushing the tube too far back in the mouth to cause gagging. Beneficial for reduction of biting behaviors. Please remember these are single use only. Special considerations to take in account when utilizing a sensory toolkit. Every child with autism is different. Just because one tool works for one child does not mean it is an appropriate tool for every child. Avoid overstimulation. The toolbox is meant to offer choices for items for families to borrow during their stay. These items are not for patients and families to take home. We often encourage families to bring their own coping tools with them for outpatient appointments or inpatient admissions. However, families are not always able to prepare for their visits. These toolkits are to supplement for families in this situation to allow their child to cope effectively during their visit. Therefore, it is important that the items are returned back to the kit after use to ensure they will be available for all patients. If you are unaware of which tool to offer, seek the guidance of your child life specialist or patient's care provider. A sensory toolkit is one of the many supports available to children with a diagnosis of autism or neurodevelopmental diagnosis. Child life specialists provide additional supports, for example, social stories, medical and therapeutic play, and various educational resources for families.
As part of the clinical redesign for care of patients with autism and other neurodevelopmental diagnoses, each clinical unit will receive a sensory toolkit. Inside this toolkit will include written handouts that explain the purpose and use of each item within your toolkit. Each unit is responsible for the care and maintenance of their toolkit. Please see your unit's service line educator if you have any questions or concerns regarding your unit's sensory toolkit. Thank you for participating in this training.